Good morning, my name is Manpreet and I'm from section 4, group 4, and we're presenting on sickle cell disease, and my group members are Pratima, Pramila, Karanpreet, Christina and Sita. And the first question is, what is sickle cell disease? So sickle cell disease is a genetic blood disorder characterized by abnormal shape of red blood cells. So as we go to the previous slide, so this is the normal shape of red blood cells, the biconcave shape that helps to carry oxygen throughout the body in the blood. So this is the abnormal shape of the red blood cell. This occurs due to mutation in the beta globin chain of hemoglobin. So now there are two types of sickle cell disease. So one is sickle cell trait and the second one is sickle cell anemia. So sickle cell trait occurs when one or both parents are carriers of sickle cell disease, and the patient represents one normal hemoglobin gene and one abnormal hemoglobin gene. As we can see from this illustration, that these individuals, they have one normal hemoglobin gene and one abnormal hemoglobin gene. So these two are the carriers of these disease. So they will not develop sickle cell disease in future, but this individual, this one they have both genes from abnormal hemoglobin, that is represents as S. So this is the more severe form of sickle cell disease. So this is 1 in 4 offspring in which this disease can occur. So it represents as 25% out of 100%. So this is the more severe form of sickle cell disease. So mostly these individuals will have low amount of hemoglobin, that is between 70 gram per liter to 90 gram per liter. Let's discuss the pathophysiology of sickle cell disease. So sickle cell disease happens due to genetic mutation of a single nucleotide that is a replacement of glutamic acid with the valine at the 6th position of beta globin chain on the chromosome 11. So now discuss how red blood cells attain the sickle cell shape. So due to low oxygen and physical exertion and exposure of the patient to the extreme cold or hot temperatures, actually put the patient's hemoglobin cells to undergo polymerization process that includes long, rigid, inflexible chains of hemoglobin to stick together and do a polymerization, which results in the crescent or C-shaped sickle cell shape. So the sickle shape of the cells actually show the decreased flexibility, and due to their decreased flexibility, they actually stick to each other and to the walls of the blood vessels. That clumping of those red blood cells results in obstruction in the vessels that inhibits the circulation in the body. Due to the polymerization of the hemoglobin molecules and the sickle cell shape, the destruction of red blood cells occur. Due to destruction, the life of the red blood cells actually drops down by 10 to 20 days as compared to the normal life of red blood cells, that is 120 days. After that, due to both processes of vaso-occlusion and hemolysis, there will be inflammatory response by our body by the release of cytokines and the red blood cells to fight the infection, as our body will have a defensive mechanism against it.
Okay, let's discuss the signs and symptoms of sickle cell anemia. Sickle cell anemia, the hemoglobin of fetal is not replaced by the sickle cell hemoglobin at 12 months of age or at around 1 year of age. Therefore, the clinical signs and symptoms of sickle cell anemia doesn't start to appear. The early signs and symptoms of sickle cell anemia are painful swelling of the hands and feet, which is caused by the obstruction of the blood vessels by the sickle cell. Another sign and symptoms is fatigue or flossiness or loss of appetite from the anemia, which is caused by the reduced RBC in the blood. And another sign and symptoms is the jaundice, which is yellow coloring of the skin and the eyes, which is caused by the breakdown of the RBC and release of the bilirubin. So another sign and symptoms are related to the complication related to sickle cell anemia disease, and it can vary from person to person. Some of the complications and signs and symptoms are vaso-occlusive and pain crisis, which is manifested as abdominal pain, leg pain, and joint pain and muscle pain. And another is anemia, which is manifested by tachycardia, pallor, shortness of breath, lightheadedness, and delayed growth and development for children. Another is acute chest syndrome, which is the signs and symptoms are chest pain, coughing, difficulty breathing. Another is kidney problem, which signs and symptoms are frequent urination, vomiting, and high blood pressure. Another complication is splenic sequestration, and which is manifested by pain in the left side abdomen, and sudden weakness, hyperventilation, and tachycardia. Sickle cell disease is also causes frequent infection, which can elevate the body temperature, such as fever, and pneumonia is the most common infections.
Let's do some patient teaching on sickle cell anemia. Parents of children with sickle cell anemia should not keep their children in extreme hot or extreme cold. They should be kept in normal temperature. For reducing pain, crisis, and organ damage, for sickle cell anemic child, their parents should adhere to sickle cell management therapy. Another consideration to be taken by the parents are like, for reducing the complication of sickle cell anemia, the children should be taken to sickle cell healthcare management team continuously for follow-up. And another one can be using a cold compression to reduce pain should be avoided, because cold can promote sickling and ischemia, and when there is ischemia there is reduced sensation, which can be it can damage the tissue, or it can be a fatal condition. Another patient teaching can be parents with children with sickle cell anemia. They should keep their children updated with vaccine, for example meningitis, hepatitis A, hepatitis B, and yearly vaccine to reduce infection. And other teaching can be parents should focus on balanced diet, and the child should be adequately hydrated. Another thing to take into consideration is the child should not be taken into higher altitude or in an airplane where the oxygen level is low, because they already have a low oxygen level in their body. Another patient teaching can be serious medical conditions of sickle cell anemia, like shortness of breath, irregular heartbeat, chest pain, cough, fever more than 38.5 degrees Celsius should be reported or should be taken medical help.
My name is Pramila Thapa Karki. I am going to presenting complication of sickle cell disease. Sickle cell disease mostly block the blood circulation and oxygen flow to the tissues. First complication is acute chest syndrome. Acute chest syndrome is the chest infection. It occurs mostly in the children. And anemia, avascular necrosis. Avascular necrosis is the death of bone tissue. Then acute pain and chronic pain, it causes block the blood flow to the microcirculation. And splenic sequestration. Splenic sequestration is the blood flow in the spleen, and it gets bigger and causes pain. Other complications are blood clots, infection, kidney problems, leg ulcers, liver problems, pulmonary hypertension, stroke, vision loss, fibrism, psychological complication. It's all due to the lack of oxygen and blood supply to the blood tissues, to different organs. So sickle cell disease causes these problems.
Care and intervention, we can do the pain management by administering the prescribed medication, and also we can arrange the massage therapists to reduce their muscle spasm. And for their hydration status, we can monitor their input and outtake of the patient as we can assess them for the dehydration by doing the skin turgors and checking the dry mucosa. And also for the oxygen therapy, we have to monitor the spo2 level of the patient, and we also have to do the check the respiratory status. And for any sign, we have to assess for any signs of hypoxia and administer any supplemental oxygen. And for another care and intervention, we can check for the infection prevention. We can teach the patient about the importance of infection prevention, as we can include the hand hygiene, and their vaccination must be up to date. And we have to make sure that the patient stay away from the reptiles, as they carry bacteria called salmonella, which can cause the bacterial infection. And after that, we can also work on the psychosocial support, as we can arrange the cognitive therapy, behavior therapy, and psychodynamic therapy, which gives outcome to cope up with the pain, anxiety, general and their mental health. And being active socially and continuing in their work also affect on their pain status.
Treatment for sickle cell disease are bone marrow transplant. Chemotherapy should be done before transplant. Transplant can be done from patient own stem cell or donor stem cell. Success rate is 90%. And the best age for this transplant is preschool age. The another treatment is managing pain. Pain can be managed by giving opioids and NSAID, and the preferred route is intravenous. And the another one is preventing and managing infection. Antibiotics are given to treat infection, and pneumococcal is given for prevention. The other one treatment is blood transfusion. Transfusion is done to increase the oxygen carrying capacity of blood. Packed red blood cell is used for transfusion to treat anemia and other complications. And the other one is gene therapy. It is done to correct genetic defect by adding modified beta globin gene to decrease abnormal hemoglobin and increase normal hemoglobin. The another treatment is hydroxyurea therapy. It prevents vaso-occlusion and pain crisis. It inhibits polymerization and reduces sickling of RBCs. It helps improving blood circulation.
So the prognosis for sickle cell disease is varying for both genders. For female, it is 42 years, and for men, it is 48 years. It depends on the severity of conditions. For example, a patient may have complications in respiratory system or kidney issues. If the bone marrow transplantation is successful, then the stem cells can make normal red blood cells that can help the patient to live a quality of life and a normal life.